Managing your cholesterol is important for your health, but how do you really understand about how to do that? So today we're talking with Dr. Kenneth Hilty with Cone Health HeartCare. He's also the medical director of Cone Health Advanced Lipid Disorders and Cardiovascular Risk Reduction Clinic. All right, that's a mouthful, but I know you're going to make everything cholesterol easy to understand. So let's just start with this. If your cholesterol levels are off, would you even know it? Would you feel a symptom?
Actually, no, Tanya, thanks for again having me today. This is something that you don't know, right? This is why we stress prevention and seeing your doctor and having this testing, especially if you have a family history of heart disease. It's important to get a cholesterol check because you may have an inherited or genetic condition. It could be related to your diet. So certainly early detection and early treatment and prevention and lifestyle modification can really reduce your risk going forward.
So no real symptoms of high cholesterol.
Not typically. I mean, some people with very high cholesterol can manifest some skin symptoms. Sometimes we see, cholesterol deposits under the eyes and things of that sort. But generally, no. People don't feel bad, unless their numbers are very, very high. So it's important for kind of the average person to go out and get their cholesterol tested. At least get it screened once.
Okay, and that was going to be my next question. Like, who should be getting their cholesterol tested? How often should you be getting it tested?
Yeah, certainly for adults, we recommend at least a screening test, probably as early as in your 20s. And that can be done through your primary care doctor, or you could even get a point of care testing. It can be done a lot of times at a pharmacy or a place like that as well. Can do testing for general cholesterol. In general, once you've established if you're known to have high cholesterol, we generally check patients at least twice a year, sometimes even 3 or 4 times a year.
And how does family history impact your cholesterol levels?
It's quite important. In fact, a lot what I do see a lot of genetically related cholesterol disorders. So remembering that, your body produces cholesterol, then we also get cholesterol from our diet. And there are certain genetic disorders that run in families, and that you may inherit that. And even though you may live a healthy lifestyle and eat very healthy, your cholesterol still could be very high.
All right, well, let's talk about, you said you're talking about diet is part of it. So let's talk about what we eat, how much we exercise, and how that helps with cholesterol.
Yeah, absolutely. I mean, cholesterol it is an important part of our body, but in general, we tend to make too much or consume too much during our lifetime, right? So exercise allows us to utilize, cholesterol, particularly triglycerides, which is a cholesterol-related particle, for energy sources, and also helps us to control that cholesterol. Diet, we should be focused on primarily lowering things like saturated fats, and these are in kind of fried foods and oils, butters, cheeses, things like that are higher in saturated fats. We want to try to lower that in our diet and get in regular exercise. That includes both aerobic exercise and also some resistance exercise training if we can several times a week.
All right, so exercising several times a week, the do's and don'ts on the eating, the fried foods, the things that we normally know are not great for us. And so you would also say add the good things into the diet, such as.
Yeah, so it's important to look at enhancing our diet with positive treatments that can lower cholesterol. One of those, particularly, it's been studied a lot, is this Mediterranean style diet, right? So this includes a lot of nuts, olive oil, seeds, sources of good, what we call, or healthy fats in our diet. A lot of studies recently actually have shown reductions in things like the development of Alzheimer's, for example, on a Mediterranean style diet, as well as preventing other cardiovascular diseases. So it's really quite a lot of data to suggest that that's probably one of the better styles of diet that you can. Of course, reducing red meats and eating more of a plant-based diet is considered to be very healthy as well.
All right, so you said that sometimes, we just have high cholesterol. It runs in our family. This is what's going to happen in our DNA. And so sometimes diet and exercise alone are not enough. And so medications are then prescribed. And most of those are called statins. Let's talk about what those are.
That's right. Yeah, the statin medications, I think it's important to talk about, right? Because I think there's a lot of misinformation in the media about the statins. They've been around for 30 to 30 years plus now, with a long safety record. And while they can have some side effects, and we understand them pretty well, they're overall considered pretty safe medicines. And generally, if we work with patients to find a medicine that they can tolerate well, they've shown to be the best at cardiovascular risk reduction, preventing developing heart disease, and they're inexpensive and they're available as pills and they're generic. So they turn out to be very useful medicines. But we also have other medications that can be used either in addition to that or instead of that. If patients have difficulty tolerating those medicines. So I think we try to take a comprehensive approach at Cone Health, which is a combination of diet and lifestyle and medical therapy if you need it. There are just some people that will not be able to get good control of their cholesterol to lower their risk with just diet alone. And that's where medications or therapies are essential for them.
So the follow-up question would be, is this like a long-term thing, or can you stop taking the statins when your cholesterol levels improve?
So many people may be able to do that. It depends on the reason for why their cholesterol is high, right? So if it's, for example, there's a weight loss or significant dietary changes and the cholesterol levels improve and they can maintain that, I'm as happy as any other doctor to take a patient off of a cholesterol medicine. But when we're talking about cardiovascular disease, somebody who's had, for example, a stroke or a heart attack, or has a genetic cholesterol disorder, without being able to change those factors, it's likely that they're going to need to be on this medication or therapy indefinitely, because that helps them to kind of compensate and improve the numbers so that their risk remains low throughout their lifetime.
Okay. All right. We're going to continue this discussion, learn a little bit more right after the break. So make sure that you stick around. And if you've got someone in the house who's got some high cholesterol or it runs in your family, get them in front of the TV for the next part. We'll see you in just a minute.